name is Michelle Trotter, and I'm a business development specialist here at Eagle. We understand there's a lot of unanswered questions and concerns regarding the coronavirus during this chaotic time. It is for that reason that Eagle is committed to providing you science-based solutions and answers to guide you confidently through this pandemic. Thank you for trusting us. We have Dr. Husong in Washington, D.C. answering these questions for you. First question we received: are you able to reuse N95 respiratory masks more than once, and what is the process or method to clean the mask if I do not have a sterilization system? What would be the formula for a peroxide mixture? Would that be effective?
The reuse of masks is discouraged as a normal practice. Right now we're not in normal times, so we can't make perfection the enemy of good. What we have to do is what is necessary. Use of an N95 mask largely stems from industrial settings where there are particles in the air. They will capture particles, 95% of the particles that are, I believe it's 3 microns and larger. So the use of those is somewhat limited. They come in various types. The common one that we see is the filtering paper mask that's supposed to fit tightly around the face or the mouth and nose. And then there's additional ones that have a valve in them, and that valve releases the air as you exhale, unfiltered. When you inhale, the air is supposed to pass through the filtering paper. Use and cleaning of these would differ somewhat, but generally it's considered that a 4-hour use period is normal, and they are considered disposable masks. But FDA has issued an emergency use authorization, and it describes certain procedures sterile or sanitizing these masks after use. I can give you an idea of how to go about it, and you can look that up at the FDA website. There are also procedures described at the CDC and NIOSH websites. Those are helpful. The procedures are generally industrial practices, so sanitizing a mask in a pharmacy or the home is probably going to be something that has to be worked out on a what's available basis. What we do know for the case of COVID-19, the virus is inactivated with hydrogen peroxide or alcohol. For the use of hydrogen peroxide, off-the-shelf hydrogen peroxide is 3%, and it can be effective at concentrations as low as 0.5%. You want to spray down a surface for decontamination. Take the peroxide bottle, dilute it 5 or 6-fold, and use that in a spray bottle. And that would do a good job. You could also wipe off the surface directly, peroxide.
How much concern should there be regarding the possible transmission of the coronavirus to and from household pets?
Generally, viruses tend to be species specific. However, in the case of the novel coronavirus, it is believed based on its genome that it did come from another species and jumped to humans. That's typical of most of these severe acute respiratory syndrome viruses. You also see that in examples like the avian flu, the swine flu. These are cases where the virus has jumped species. So I had not thought of it as a significant issue until recently. Report of the tiger in the Bronx Zoo had come down with the virus. So clearly there is a theoretical possibility that a pet could transmit the virus.
What is the likelihood that an asymptomatic carrier will shed the virus?
A study in Iceland recently came out, just this week, showing that of a random sampling of people in the Reykjavik area, 50% of the people tested were COVID positive and asymptomatic. It's very likely that people will have the infection and their immune systems will prevent it from advancing. That's also, in most viral infections, an association of not only the vulnerability state of the patient, but it's also a related factor of the amount or dose that the patient receives. So it's very likely that they will be asymptomatic and shed the virus. So even in the early stages, before they feel symptoms, they could advance to being symptomatic. In the meantime, they'll be shedding it because they've become infected.
If you already contracted the coronavirus, are you still immune to it going forward?
Upon recovery from a viral exposure, your system develops antibodies. One of the treatments that's being investigated currently is the use of convalescence serum. The patient has recovered and has immunity in the form of antibodies, and that the antibodies can be extracted and given to another patient for treatment. It's referred to as a passive immunity because the patient's not making his own antibodies until after he's been exposed for usually about 2 weeks, 10 days to 2 weeks. But by giving the patient antibodies from another convalescing patient, that immunity can be transferred. Most coronaviruses have an immunity that's developed and that lasts for about a year, much like your flu shot gives you immunity for a year.
Thank you, David. If you'd like to watch any of our earlier episodes, you can find them on our social media channels or also on our website. We also have a page on our website dedicated to COVID-19, bringing you facts and tips on how you can stay safe and healthy. We will continue to bring you answers to your questions that we receive through our online form every Friday to make sure we help you feel safe and educated about the coronavirus.